Hello and welcome back to the channel. You have a C-section scar. You've had your kids, you're happy, they're all grown up, but this C-section scar is really annoying you. Don't like the way it looks, things get caught up inside. What can we do about it? My name is Dhalia Masud, I'm a plastic and reconstructive surgeon, and we're going to talk about what you can do if you have a C-section scar that you're unhappy with, and I'll show you some examples. When you have a C-section scar, one thing that can happen is that the overlying skin and the fat can get stuck to the wall or the layer over the muscle. What can happen when this occurs is that you can get the occasional pulling sensation when you're walking or moving. You will have some numbness along the scar, but annoyingly, you can get a ridge, particularly on the side view. When wearing clothes, it just feels a little bit uncomfortable. In the summer, it can get sweaty in these areas and you can get all sorts of symptoms associated with this. So what can we do? There's a variety of things that we can do, all ranging from local anesthetic things as well as general anesthetic, bigger operations where we need to put you to sleep. From a local anesthetic point of view, what we can do while you are awake is refresh that scar. We cut out the entire scar and close up fresh skin to fresh skin and ensure that it doesn't get stuck down again. This is a local anesthetic procedure, which means you will be awake. You come into our clinic to have it done. The most painful part of this procedure is when we inject the local anesthetic. We will wait for a good few minutes for this to work, and then we will remove the scar. You will feel some pushing and pulling throughout the procedure. And once we've removed the scar, we will reclose this scar and apply some dressings. After the surgery, we will advise you not to do any heavy lifting, any bending over. You won't be able to drive for a couple of weeks, so you do need to have someone to give you a lift when you come and see us. And then we will remove the dressings after about a week. And after 2 to 3 weeks, we will advise you to massage the scar to make sure everything settles nicely. This is a patient that we did and who's given us permission to use her photograph where we did the local anesthetic correction of her scar. The scar at the beginning or prior to the surgery, you can see is tethered. She has a wedge where the C-section scar is, which if you stretch out, you can see the extent of the tethering and the width of the scarring. And now this was causing her a lot of functional problems, and also she didn't quite like the look of it. She didn't want to have a general anesthetic, and she just wanted us to focus on the scar to have this improved. We decided to improve this scar under local anesthetic, where I removed the scar and we closed it, fresh skin to fresh skin, and this is what it looked like 2 weeks after the surgery. She's delighted with the results. Now, this may not be suitable for everyone. You may want to improve other aspects of the abdomen, in which case this would not be an ideal case. Now, the aim of this procedure is simply to focus on the scar and remove all the symptoms that are associated with the indentation of the scar. For some people, you may want to go slightly further. And what this means is removing the scar and correcting the lower bulge of your tummy. Now, this is more of a tummy tuck procedure, which can either be mini, where we only mobilize or improve the lower aspect of the lower half of the tummy, or we can extend the area that we want to improve and extend it all the way to just underneath the breast, and that will be a full tummy tuck. Now, this is a very difficult decision to make, and it really does depend on what your goal is. If your goal is simply to remove the scar, then maybe the local anesthetic correction of the scar would be suited to you. Now, if you want to remove the scar and improve the lower abdomen, or even go further, improve the entire abdomen, this will be best treated with a tummy tuck or abdominoplasty procedure. It's a very difficult decision to make, but if you have a consultation, we will be able to have a chat and have a discussion to see what is suited to you. Thanks for listening to our video, and thanks for listening to the end. Please do like and subscribe, and hopefully I will see you in the next video. Bye.